Essentia Health is marking 25,000 referrals through Resourceful, its free online guide that links patients to local community services. This week, we talked to Jill Doberstein, a community outreach manager at Essentia Health, about how the system is bridging the gap between patients and local support resources. This is Hospital Matters, a podcast from the Minnesota Hospital Association. In this episode, the MHA's Tim Nelson spoke with Jill Doberstein, a community outreach manager at Essentia Health, about Resourceful. Resourceful is Essentia's online guide that helps connect patients with free or reduced cost community services in their area, like housing, food, and transportation. In 2025, the platform reached a major milestone. More than 25,000 referrals have been generated since its launch.
Tell me a little bit about the start of Resourceful. Where did this begin?
2019, we started asking questions related to social determinants of health, or now called health-related social needs or social drivers of health. It has many names, right? So we started asking our patients questions in a few clinics just to kind of pilot how is this going to go. Asking about food insecurity, housing needs, transportation barriers. And what we quickly learned was patients are identifying these needs, and we didn't have a lot of resources at our fingertips to be able to connect them to. Certainly, there are what we might call subject matter experts in the clinic or in the hospital, those social worker, case manager, community health worker type roles. But that would require referring every single patient that has those identified social needs to those people. And we thought there's got to be a way we can do something better. So we pulled together a few community partners in our trusted network of we're all doing this work together to address social needs, and maybe through a health equity lens, and said, let's vet some different vendors that are out there that can help us connect clinical and community resources together. So we ended up looking at Find Help, which is the national platform that Resourceful lives on. Resourceful is our white label at Essentia Health. But there are many other health systems across the country, including Mayo Clinic and many other Minnesota-based companies as well, that are using the same platform, which is also helpful for the community-based organizations. And so what we did was determined that we could embed this platform right into our electronic medical record to be able to place electronic referrals from our health system for our patients to community-based organizations that could provide those key services like transportation or housing or food resources. And so we thought, wow, this is great. The other piece of this that I often tell people is sort of the liquid gold of this platform is that not only can we send that electronic referral on our patient's behalf, but we also get to know what happens. Was that community-based organization able to enroll them in their programs? Did they help our patients? Maybe they determined they weren't eligible. They didn't have the right eligibility criteria, so they referred them elsewhere. Or they weren't able to get in contact with them, which is valuable for us to know if we happen to see that patient again in a couple of weeks, and we can say, hey, it looks like this organization tried to reach out to you, but they weren't able to connect. Let's try to connect now. So really that full circle opportunity of not only being able to place a referral to a community-based organization through the patient's electronic medical record, but then also to get that outcome back. When we discovered this platform and learned what it could do, it was a no-brainer that it was something that we wanted to embed in our health system as a tool for all of our care providers.
So you talked a little bit about this being a widely available platform, a national resource. Is it an advantage? Can you cooperate with other systems, with other geographies to sort of make this work?
Absolutely. So the first step actually, when you log into the platform, is to put in your zip code. So it's going to bring you to local resources. But even if I'm working with a patient who is maybe a snowbird here in Minnesota and wintering down in Florida, and they're looking for some resources in Florida this winter, I can search the zip code that they're moving to and find programs and services down there for them. So the benefit of being this national platform is it covers, the entire country. In addition, those of us here in Minnesota, health systems that have embedded this same type of platform into our EMRs, such as Mayo Clinic, Children's Hospital of Minnesota, Fairview, Essentia, Sanford, all of those community-based organizations are getting referrals the same way. So if they've enabled electronic referrals and they serve all of Minnesota, like the food group, for example, they might get referrals from Essentia and from Mayo and from Fairview, and they're all coming into the same referral dashboard. They all come the same way. They can easily close the loop on those referrals with a status update the same exact way. So having us all aligned in that process also benefits the community-based organizations to have a smooth, kind of easy to understand and similar workflow.
So come in any door, essentially.
Yeah, come in any door, whether you're coming through Essentia and Resourceful or you coming through Fairview or Sanford or Mayo, it really doesn't matter. We're all collectively trying to address the health-related social needs of the communities and patients we serve.
I see a couple of things here that sort of differ from sort of traditional in-person services, those referrals to social workers or something like that. One of them is there's clearly, no gap here, no missing handoff if a provider is sitting right in front of a electronic health record. The other thing I see is there's some possibility for patients to sort of interact with this platform themselves. I mean, they can go online and sort of navigate it at their own pace or for their own uses as well, right?
Exactly. So in terms of your first question, utilizing social workers or community health workers as those care team experts, we still do that. If a patient identifies multiple health-related needs, social needs, we will make a referral to those teams who can work with them long-term and provide that extra support. However, if I am a nurse in a clinic visit with a patient and they say, I don't know where I'm going to get my next meal, I can go into this tool and say, I'm going to place a referral to Second Harvest Food Bank, and they're going to reach out to you and get you connected to local food pantries, apply for long-term food supports like SNAP enrollment, and things like that. So it sort of takes that need to bounce someone to another person, away and be able to address that need right away in real time. However, to your point though, about is this accessible to patients as well? It's not only accessible to our patients, but it's also accessible to our communities that we serve. So really anybody can use this platform. And so I do a lot of education in the community with social workers, navigators, all types of helpers in community-based organizations like public health or community action agencies, housing agencies, et cetera, and teach them you can share this with your clients and family members that you're serving. If you're working with students on free and reduced cost lunch programs and their family needs some additional assistance, send home, an info sheet on Resourceful, and in their backpack, their family can go on the website and look for food or housing or transportation or mental health resources. It's accessible not only to our care team members to help navigate, but also to our patients to be able to do on their own. And we share that through things like our after visit summary. If you need resources like this, click here. And then also we promote it in the community with our partners by sharing it on social media and having our partner agencies like Public Health and Human Services put a link to Resourceful on their website. So really trying to engage the broader community that this is a resource for you too.
And of course, this isn't part of the provider billing or insurance or a bill to the patient or anything like that, right?
That's right. So the tool Resourceful itself is free to anyone to use. And any referral that's placed on the platform are to free or reduced cost services. That's actually the criteria of the platform. So although we recognize significant health benefits in programs like chiropractic or acupuncture, or massage, or all sorts of different wellness things, unless those providers offer a sliding fee scale, they say we accept Medicaid, and Medicare benefits, whatever that might look like, they won't be able to be listed on this platform. The platform is really meant to be for free and reduced cost services to meet the social needs of our community. So it is a one-stop shop, but it's also sort of not. So hopefully that helps kind of explain the type of resources that are on there and who can use it at no cost.
Now, you said the idea for this started in 2019. It's been around for a few years. You've got a little track record on it. Actually, not a little track record. You sort of hit an important milestone here in 2025. Tell me about that.
So we launched Resourceful about 3.5 years ago, again, embedding it into our electronic medical record at Essentia. And then also doing that community promotion of this is a resource available to all community members, community helpers, et cetera, and have watched it grow over the last 3.5 years and just hit that milestone of 25,000 referrals placed on the platform, which is very exciting. And we do monitor it on an annual basis, including what does the community engagement look like? So how many of those referrals are coming from Essentia for patients and how many are coming from community-based organizations or self-referrals? And we're seeing that continue to increase over time as well.
And what does that split look like? What's the community referrals and the Essentia referrals look like?
Yes, certainly we see the majority of the referrals coming through the health system because we're specifically screening for those social needs. Every patient now, every visit, every time across our primary care clinics, and now when patients are admitted to the hospital. So we are having that direct conversation about, maybe they can't afford food, so they're not going to pick up their medical prescription from the pharmacy. So being able to understand that perspective of the patient of what their needs are and putting those pieces into action in terms of how can we get you some financial assistance through public health and human services or through whatever community-based programs. So we are asking it on a regular basis and addressing those needs as part of our everyday workflows in working with patients in the clinic and the hospital side of healthcare. So certainly we are using it to its fullest extent. But again, the more we engage with community and the more our community partners find this resource and see how well it works, the more we're seeing more and more referrals placed at the local level as well.
And of course, this isn't an academic exercise. You're not doing it just for the sake of doing it. What kind of results are you seeing? Are you seeing a difference in the community? Are you seeing a difference among your patients?
Absolutely. So we track, again, over the last 5 years, all of the health-related social needs data for our patients. So how many people are we screening? How many people screen positive for what types of needs? And we can even break that down in terms of demographics. Like, is there a specific need for specific resources in specific communities and maybe even for specific populations? Maybe it's older adults. Maybe it's our Indigenous community in the specific area. So we're really looking at that and making sure that the resources within the platform match those community needs. So do we have these types of programs listed in the platform? Are they accepting electronic referrals? Now, I didn't mention this earlier, but the electronic referral piece is sort of a game changer in terms of patient responsibility. So the old workflow used to be, okay, Tim, you have this need. Here's a couple of brochures for some community-based programs with their phone numbers and their websites, and they're great. They can help you. So take these brochures, Tim, give them a call. Good luck, right? And I just gave you a bunch of homework to do. It's like a to-do list.
Right.
Where
The burden is
now
on me as a patient.
the burden's on you. As much as I think I'm being helpful, it's maybe not super helpful. It's like you're overwhelmed, right? You're being discharged from the hospital. You've had this experience. You've got these social needs. And now I have to call all these places and see if I'm eligible and figure it out. Where instead, now with this platform, I can see who's eligible. Is the program available? Are they on a wait list? Or, what does that look like? And then I can place that electronic referral with your consent to this community-based organization with your contact information so that they can contact you and say, oh, it looks like you're eligible for our program. I see you're interested. Here's what we offer. Can I get you enrolled? And can we provide those services? So really taking that homework off of your plate is very beneficial part of Resourceful.
And tell me a little bit about the kind of people that are using it. Tell me a little bit about, what you know about who's being helped here.
Of those 25,000 referrals that we just hit with this milestone, I can tell you in the data, it shows all types of different programs and services for all types of different people. So whether it's for children, families, elderly, in fact, we see often a filter being used for veterans. There are programs and services only available for veterans. And we see it for all different types of community members. And then in terms of what types of programs and services, because Essentia Health serves 3 states, Minnesota being the primary one, but also Wisconsin and North Dakota, we can see what are the greatest needs in each of those communities. So what are people searching for? Is it food? Is it housing? Is it transportation or mental health care? So we can look by individual areas to see kind of what those biggest needs are and searches are.
Well, it sounds like a great program. Congratulations on that milestone. And here's to the next 25,000.
Okay, thank you so much, Tim.
Again, that's Jill Doberstein, a community outreach manager at Essentia Health. I'm Abby Mocktig, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.